Hello, guys. Welcome to another episode of the Anti-Pharmacist podcast. How has your week been so far? Hope you've had a nice week, regardless of the situation of the economy. Abi, we can't come and kill ourselves now. I hope you are not letting it get to you too much. And I hope you had a nice Valentine's as well. Responsibly, though. Alright? It was all warm and cozy at my hand. Okay? And I hope you got lots of love from family and friends and gave some love back as well. Okay, so today I've been thinking about this particular topic for a while. I've actually had it in the list of topics to discuss for months now, but I've just never found that right time to discuss it. But recently I've been watching this series, which is about a doctor who is going through some rough patches in her life. Like, she's encountering some mental health issues, alright, especially at work, in which she's being bullied, she sleeps less, she's stressed, she's not getting job satisfaction. So at the heat of the moment, after being bullied by a superior yet again for something which exactly is not her fault, she quit her job at the spur of the moment. But on getting home and the mother finding out, meanwhile this mother is one who is so proud of her daughter, tells everybody that cares to listen that yes, my daughter is a doctor, a very brilliant one, in one of the best hospitals in the country and all of that. On finding out that her daughter had just quit her job, she got angry and was like, no, she has to take that job back. Nothing should make her quit her job. She has been bragging about her daughter and all of that. And this daughter made her know that she's not happy at this job. She's being bullied every day. She gets less and less sleep. She's not being rewarded for what she does. She's unhappy. And she had just been diagnosed of depression. Clinically diagnosed, and she's on medications, antidepressants. When this mother heard this, she was so shocked, like her own daughter, a brilliant doctor daughter, being diagnosed with depression. Then she calmed down and had to let this daughter know that okay, she just realized her fault, that she prefers a living daughter to a dead doctor. Do you understand? So this got me thinking that this actually happens even in our society today. You see, a lot of people put healthcare professionals on this pedestal, like we're invincible, like we are not like mere mortals, like we don't get sick or something. And this is why the topic of today's episode is healthcare professionals, superhumans or not. You think about that in your own mind. How have you been seeing healthcare professionals? Are you one of those who will see a healthcare professional sick and you'll be wondering, why is this one sick? Is he not a doctor? Is she not a nurse? Is she not a pharmacist? How can a whole pharmacist have catarrh? How can a whole pharmacist have malaria? Are you one of those that think that way? Well, I'm here to tell you that healthcare professionals are not superhumans. We are not invincible. We are humans just like you. So I'll be addressing this topic in two phases. The first phase is talking to the public, letting you guys know that we are just like you and reasons why. And number two, I'll be addressing my colleagues. The public, the society can make you feel so much like you are a hero, you are all in all, you are invincible, so much that you start believing it. This has made a lot of my colleagues to become like hypochondriacs, people that believe that they can never be sick. I'm not talking about faith right now. I'm talking about just that mindset that as a doctor, I know about diseases, I should not be sick. As a pharmacist, I'm an authority on medications. There's no medication whose mechanism of action I don't know. So if there's any disease, I should be the one to know. But let me tell you guys, when it comes down to it, we are all humans together. And mind you, even healthcare professionals are more prone to these infections, to these sicknesses or conditions than the members of the public. Well, I will tell you why, alright? We're around sick people all the time. And there's this saying that whatever is around you is what comes near you. I don't know how to put it. I don't know what better way to put it. But you understand what I'm saying. We are around sick people all the time, around illnesses. So we are more prone. This could reduce our immunity. Apart from that, most of us are stressed all the time. One healthcare professional to many patients, doctor to patient ratio is nothing to write home about. The same thing with pharmacist to patient ratio. We hardly have public holidays. We hardly have days off. Many of us do not have weekends. The stress, some of us even do not get to eat well. All of this reduce our immunity, coupled with the fact that we are around sick people all the time. We are prone to illnesses, even more than you, that maybe you have not been to a hospital in months. So you are not around sick people. That is number one. Number two is that the demand for our services is so much that we tend to neglect our health, even if not deliberately. You're tending to other people so much so that you forget about yourself. Even when we have medications to take, we are prone to forgetting to take the usual dose. So you see a lot of doctors missing their doses, a lot of pharmacists forgetting to take their medications because the time they're supposed to use to remember, they're attending to other people. That's why this healthcare profession is more of a service to humanity than just a profession or a career. You put other people beyond yourself. The time you're spending with your family, for example, before you know it, a call comes in from a patient that you have to take, even when it is not convenient, even at ungodly hours, you still have to attend to all of this. So this has given the public the impression that, this person is an authority, this person is a pharmacist, you know everything about medication, you should not fall sick. So it rubs me off wrongly when people just see me sneezing and say, you, Odidi pharmacist, you are having catarrh. Like, really? Hello, sir, I'm a human being too. Well, I do not blame these people sometimes because some of them speak from the aspect of ignorance while others are just trying to be goofy, but not knowing that they are actually offensive in the way they say it maybe or in their perspective. There's nothing wrong with a pharmacist falling sick. The fact that I know medications and what they are used for doesn't make me immune to diseases. Of course, I know the right thing to use when I have a condition, but I'm not a magician. Just like I would tell you to exercise patience and use this medication the right way, the right dosage, at the right frequency for you to get maximum benefit, I have to do the same for the medication to work for me. So when I have malaria, I have to take the anti-malaria well for the number of days for me to get well. You don't expect me to have malaria and I take medication and the next day I'm fine. You see, it doesn't work that way. Now to the second phase. Many of the healthcare professionals, like I said earlier, because of that pedestal that people put them in, they hide a lot of things. They have a lot of issues that they ignore because, I'm a doctor. Nobody must hear that I have this illness. I'm a pharmacist. Nobody must know that, or they just ignore it. They become hypochondriacs. I can't fall sick mentality. When they're supposed to seek help, they do not. When you're supposed to visit another healthcare professional, you don't. I'm a pharmacist. I have this illness. I know the medication to use now. So you don't go to the hospital. You don't see a doctor. You don't see a specialist or a consultant for your case. It shouldn't be that way. We are not superhumans. There are times that a doctor can become a patient. It can even happen at the snap of a finger. Alright? Do not be surprised that that doctor that is prescribing anti-diabetics for you or antihypertensives is also on antihypertensives by himself or of his own. Or that pharmacist that is recommending medications for your skin disease is also dealing with acne. That's just life. Alright? Or that optometrist that is recommending glasses for you, checking your eyes, is using anti-glaucoma eye drops and even glasses. It is not out of place because we are all humans, and like I said, even we as healthcare professionals are more prone to these illnesses than members of the public. Look at that COVID-19 period. In developed countries, in the UK, in the US, if you see the statistics of healthcare professionals that actually died from COVID, you would be surprised because they are open to these things. Not to talk of statistics of healthcare professionals that would actually have the COVID but survived it. Because we are prone, we were all over the place then. We were all open to it. When people were being isolated, when people were staying at home to prevent spread, we were going to work every day, being exposed to it. Now you tell me that if such a person comes down with COVID, say, oh, I thought you're a healthcare professional. It doesn't work that way. It doesn't. So I want to correct the public perspective that healthcare professionals do not fall sick. Please, do not even think that. Even case in point, myself, have dealt with acne for years. I hear some insensitive comments like, oh, you should not have acne now. Maybe you know what to use. Maybe you are a pharmacist. But unknown to them, I've seen dermatologists. I'm on top of the situation, using the medications I'm supposed to use. Alright, and it's a work in progress. Not to talk of the fact that my acne is stress-induced and has a little of genetics undertone. But then they do not know all these things. All they are saying is this pharmacist that has acne. So a lot of people, they will not seek help. Even in this era of mental health, a lot of health professionals are dealing with mental health issues. I remember a while back when I was so down because of a personal challenge in my master's degree project. That day, I wasn't even up to it. If I had a choice, I would just go home. But I could not because of the demand that was placed on me by my patient. I was at work after having cried with swollen face and red eyes. I still was attending to patients. Some saw it and they were like, "Fam, what's wrong?" and all of that. Some, tried to comfort me and all of that. Others just ignored it. Well, it's not their duty. But then I still had to carry out my duty. In a saner climb, I should go home, right? And deal with it. But then I sucked it up and kept working. Thank God for encouragements here and there, and I was able to overcome the challenge. Some people will not come back from things like that. There were days that I was down with malaria, serious one, but I still had to attend to patients. A lot of doctors are dealing with things, mental health issues, not everything. It's not all illnesses that are obvious, that you see in someone's countenance or on someone's body, Some are ones that you do not know about. You have heard of doctors dying of hypertension or other different kinds of diseases. At that point, you forget that they are doctors, but they are just human beings like you. And to my colleagues, do not be afraid to voice out and seek help when you need it. Your profession does not make you any less human. You are a human being too. When you need help, when you need someone to talk to, when you need care, please reach out. Not just about mental health now, even about your physical health. When you have a chronic illness, reach out to another specialist. Reach out. Do not just say, I'm a doctor, I'm a consultant, I should know how to take care of myself. No. When it comes down to it, we are all human beings and everybody will die. But how you treat yourself may just have a bearing or an effect on how long you live. So let's treat ourselves with more kindness. When next, as a person, you see that pharmacist of yours a little bit down, you just be like, "Fam, what's wrong now?" You could just be the one to brighten their day by your little jokes and your little words of encouragement. We also need it sometimes too, especially with the situation of things around. You see, when you see your doctor coughing, do not give snide comments. You could just, just keep quiet if you have nothing nice to say. Alright? So, that is what I want to tell you today. That healthcare professionals are human beings too. We are not superhumans at all. You have that pharmacist friend, you have that pharmacist colleague, you have that pharmacist family member, and you see that they are sick or something. Support them anyhow you can. Encourage them, to see specialists if they have to, especially when it comes to mental health. Alright? And my colleagues, healthcare professionals, let's get off our high horse. We are humans too. Don't let the public deceive us to believe that we are not, that we are invincible. Seek help when you need it. Go see a doctor when you are sick. Alright? Take the right medications when you have to. Take a break if you have to. Because when it comes down to it, God forbid anything happens to you, life goes on. So that is what I have for you today. That healthcare professionals are in fact not superhumans, but are humans just like everyone else. And with that, I say thank you for listening up to this point. Please help my ministry. Help me to reach these 500 subscribers. Don't just see my post and, just pass it by. These are information that will be useful for you. Alright? So please, like, share, follow, subscribe, especially share this podcast so that I can reach as many people as possible. I would also want to encourage you to follow us on social media, on IG, on X, engage us, suggest topics to us. If there's anything that you do not understand about your medications, about your health, ask the questions. It could just be another interesting topic for another episode of the Anti-Pharmacist podcast. Thank you so much once again. And I say, till next time, stay healthy and God bless you.